Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et le Premier ministre Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Good afternoon. Bonjour. As you know, we announced our first presumptive case of COVID-19 on March 11th, and we knew there would be more cases. Your health and safety are my top priorities. Making sure you have current information is part of that, and that's why we're here today. I just want to briefly thank everyone for all the incredible work that is being done. I know you see myself and the Premier daily, but there are people who provide vital support that you don't see, such as our team at the Department of Public Health and the Department of Health, all the essential workers that are working today behind the scenes. I acknowledge the doctors and the nurses in the front lines yesterday, but I want to acknowledge that the entire team of people who are working in essential services right now. So, for instance, janitors and also people who work in nursing homes, hospitals who don't have the option to work from home. There are so many dedicated people who may not get a lot of recognition, and I want to thank you for doing so much in this time of uncertainty. You are the unsung heroes. Ma priorité absolue est votre santé et votre sécurité. S'assurer que vous disposez d'informations à jour en fait partie, et c'est la raison pour laquelle nous sommes ici aujourd'hui. Je voudrais prendre un petit moment pour remercier tout le monde pour le travail incroyable qui est fait. Je sais que vous me voyez, moi ainsi que le Premier ministre, tous les jours, mais derrière, il y a des gens que vous ne voyez pas, qui apportent un soutien vital. Il y a notamment notre équipe à santé publique et au ministère de la Santé, les concierges par exemple, ou les employés dans les maisons de retraite ou les hôpitaux qui n'ont pas la possibilité de travailler à la domicile. Il y a tellement de gens dévoués qui ne reçoivent peut-être pas la reconnaissance qui leur revient. Je tiens à vous remercier pour tout ce que vous faites en cette période d'incertitude. Vous êtes des héros méconnus. I know that many New Brunswickers are taking the necessary steps to help flatten the curve in this outbreak and slow its progress, and I thank you. All New Brunswickers must take the state of emergency announced Thursday by the Premier seriously. We can't be complacent right now. At this briefing and others to follow, I will continue to say, stay home, protect yourself and your loved ones, and also the frontline staff, people working in the hospitals, again, that don't have the choice of staying at home to work. Remaining at home, maintaining social distance, and washing your hands frequently saves lives. Les tests ont permis d'identifier 6 autres cas présumés de COVID-19, ce qui porte à 17 le nombre de cas présumés ou positifs au Nouveau-Brunswick. Les 6 nouveaux cas sont un homme entre 40 et 50 ans dans la zone 2, le sud de la province, qui a fait une croisière. Une femme entre 50 et 60 ans dans la zone 3, centre de la province, qui est en contact direct d'un cas présumé préalablement identifié. Une femme entre 60 et 70 ans dans la zone 2, le sud de la province, qui a fait une croisière. Un homme entre 60 et 70 ans dans la zone 2, le sud de la province, qui a fait une croisière. Une femme entre 50 et 60 ans dans la zone 2, le sud de la province, qui a fait une croisière. Une femme entre 20 et 30 ans dans la zone 2, le sud de la province, qui est un contrat étroit d'un cas présumé lié à un voyage. Les tests diagnostiques ont confirmé qu'il s'agit des cas présumés. D'autres tests seront menés au Laboratoire national de microbiologie à Winnipeg pour confirmer que ces cas sont bel et bien le COVID-19. Testing has identified 6 additional presumptive cases of COVID-19, bringing the number of presumptive or positive cases in New Brunswick to 17. The 6 new cases are a male between 40 and 50 in Zone 2, which is the south, who had been on a cruise, A female between 50 and 60 in Zone 3, which is the central part of the province, who is a direct contact of a previously identified presumptive case. A female between 40 and 50 in Zone 2, which is the south, who had been on a cruise. A male between 60 and 70 in Zone 2, which is the south, who had been on a cruise. A female between 50 and 60 in Zone 2, which is the south, who had been on a cruise, and a female between 20 and 30 in Zone 2, which is the south, who had a close contact to who is a close contact to a travel-related presumptive case. Diagnostic testing confirmed the cases as presumptive. Additional testing to confirm the cases as positive COVID-19 case will take place at the National Microbiology Laboratory in Winnipeg. I know many of you have questions about how to determine if you have COVID-19 symptoms. I'm extremely pleased with the public response to the new online self-assessment tool we introduced to help New Brunswickers determine whether they should call the 811 line. My understanding is I think 5,000 people visited that site yesterday. So I'm very, very happy to hear that. Actually, sorry, is 5,500 individuals used the self-assessment tool on Friday. So this has eased the pressure on 811 and has led to reduced wait times, which has allowed our healthcare professionals to assist callers more promptly. So I actually tested the system myself yesterday, so I actually called 811 myself and I waited for half an hour before I reached someone. So and my understanding is that today the wait times are less than that. So the symptom assessment tool at the gnb.ca coronavirus page offers useful advice on how to respond based on symptoms you may have, whether you should seek medical assistance immediately, get help soon, or isolate yourself from others. I also encourage those with access to a primary care provider to utilize their ability to provide virtual care via video conferencing or telephone. Primary care providers are equipped to help support and identify patients that require testing for COVID-19. Effective immediately, and for the duration of the emergency, patients with drug coverage under New Brunswick's public drug plans will only be responsible for the initial co-payment on a prescription fill or refill. For example, a patient with a 90-day prescription will only have a co-payment for the first 30-day refill, for the first 30-day fill, and there will be no co-payment required for the second and third 30-day fills on the same 90-day prescription. This applies to all New Brunswickers that are on the public drug plan, including many seniors and low-income individuals. À compter de maintenant et pour la durée de la situation d'urgence, les patients couverts par le régime public d'assurance médicaments du Nouveau-Brunswick ne seront responsables que de la quote-part initiale d'une exécution ou d'un renouvellement d'ordonnance. Par exemple, un patient ayant une ordonnance de 90 jours n'aura qu'une quote-part à payer pour le premier remplissage de 30 jours. Il n'y aura pas de quote-part à payer pour le deuxième et le troisième remplissage de 30 jours sur la même prescription de 90 jours. Cette mesure s'applique à tous les Néo-Brunswickois et Néo-Brunswickoises qui sont inscrits au régime public d'assurance médicaments, notamment de nombreuses personnes âgées et à faible revenu. It's important again to remind everyone that although there may not be cases in your area yet, you need to act like there are. There are people traveling from all over the world to different parts of New Brunswick, and we are anticipating that if they stay at home and self-isolate, then as they develop symptoms and call 811 and continue to self-isolate while they wait testing, then we can contain the travel-related cases. That is our goal right now. We need to behave as though we all have COVID-19. I understand the numbers and the privacy around COVID-19 has been a point of discussion in the media. However, at this time, we will continue to adhere to our provincial privacy rules. As I have previously mentioned, should a situation arise where New Brunswickers need to be made aware of a potential public exposure, we will do so as soon as the information becomes available, as we did in the case of the measles outbreak last year. This situation is fluid, but one thing that remains constant is that we will continue to work together to support one another and to provide crucial services and information to the people of New Brunswick. We need to look after one another and ourselves. Please maintain healthy eating habits, exercise regularly, get lots of sleep, and wash your hands frequently. Veuillez conserver de saines habitudes alimentaires, faire régulièrement de l'exercice, dormez beaucoup et lavez-vous les mains fréquemment. Keep informed, but be mindful of taking in too much information, especially from social media. This is an unprecedented situation, and it is affecting all of us all over the province. From kids to adults to seniors, we're all trying to adapt as quickly as possible to stop the spread of COVID-19. Every day matters, and that's why staying home is so important. This isn't one marathon, but several. New Brunswickers are resilient, and the ties that bind us to our family, our friends, and our community will remain strong. We will get through this together. Thank you very much.
Good afternoon. Bonjour. As we've just heard from Dr. Russell, there are 6 new presumptive cases of COVID-19 in the province, bringing the total of confirmed and presumptive cases to 17. This is not surprising news. Based on what we've seen in other jurisdictions, we know that the numbers will continue to rise. We have put measures in place here in New Brunswick to try to slow down the rising number of cases. With our province under state of emergency, I'm imploring people to continue to take this situation seriously. If we continue to self-isolate by staying in our homes and avoiding contact with others as much as possible, we can succeed in our goal of flattening the curve and protecting our most vulnerable residents. Si nous continuons à nous auto-isoler en restant à la maison et en évitant le contact avec les autres autant que possible, nous pouvons atteindre notre but, qui est à planir la courbe et de protéger nos résidents les plus vulnérables. In the coming weeks, I will have more data and will be able to make decisions about whether select facilities can start to reopen. But for that to happen, New Brunswickers have to do their part right now. Staying home now will reduce the duration of the emergency measures currently in effect. Starting today, the border between Canada and the U.S. has been closed to non-essential travel. This decision by the federal government is aimed at stemming the spread of COVID-19, and I know it's the right thing to do. In New Brunswick, we have an uncommon situation. Residents of Campbell Island are concerned about accessing the United States now that the border has closed. The Canada Border Services Agency and U.S. Customs and Border Protection are aware of those geographical challenges that affect these residents. I've been reassured that residents of the island who intend to travel directly between Lubec and Calais in Maine for essential services will not be restricted in those travels. Additionally, they will be able to travel from St. Stephen to Campobello Island directly to the United States as they have done for many years. I want New Brunswickers to know the government is doing its part to make sure that returning travelers know what is expected of them. Travelers with symptoms are not being allowed to board airplanes. Everyone who arrives, whether by air or by land, is being screened at the border. If they present symptoms, they will be separated from others, and public health will conduct isolation and testing. If they do not have symptoms, they will receive detailed information on what is expected of them. All travelers must isolate themselves for 14 days after returning home. Anyone who gives these travelers a drive home from the airport or otherwise comes into contact with them must also self-isolate. I have heard that residents are calling 911 to report individuals who are not properly self-isolating. We are working on implementing a phone line and an email that people can contact for advice on their concerns of how to help family members and neighbors comply with the state of emergency orders. This system will be in place by tomorrow, and the number and email will be shared on the GMB website and social media channels. For now, the best thing you can do is to direct returning travelers and all residents to follow the guidelines laid out in the state of emergency order. As Dr. Russell said, we have been working hard to address the issue of long wait times for people calling the 811 telecare line, and we are making progress. We have set up extra lines and created a new outbound call center staffed by 15 nurses to return the backlog of messages. Our target right now is 30 minutes to receive a call back. And as noted earlier by Dr. Russell, that was tested directly and it's working. And I only can see that getting better and more responsive. I'll also ask you to please listen to Dr. Russell's advice and refer to the new self-assessment tool available on Government of New Brunswick's COVID-19 website before you call 811. Patients who do call telecare can also use an automated system to assess their symptoms. I know the past week has been incredibly difficult for everyone. We're all trying to adapt to a new temporary way of life. We will continue to make changes as needed in the days ahead based on the advice of public health to ensure the safety of all residents. I'm inspired, as always, by the resiliency I see in New Brunswickers. I know we will persevere, and we will get through this difficult time if we remember that we are in this together. We share our ideas, our thoughts, and our assistance. I am confident we will fight this health crisis, and we will win. Thank you. Merci.
Thank you, Dr. Russell and Premier Higgs. We'll now proceed with questions from the media. Nous allons maintenant procéder aux questions des journalistes. First up is Laura Brown from CTV.
Dr. Russell, could you tell us how the people so far who have been presumptive or confirmed as having COVID, how they're doing right now, and if anyone at this point has been hospitalized?
As far as I know, the people are self-isolating at home. But if I have any new information, I can bring that back to you. But as of right now, I have not heard of anybody that is not self-isolating at home.
So all mild symptoms?
Mild to moderate would be the case that you would be able to stay at home and self-isolate while you're recovering.
And a follow-up, Laura?
That was it. That's fine.
Thank you. Megan Yamova, Global News.
Thank you. What percentage of people calling 811 with symptoms are actually getting tested, or are they just being told to self-isolate if they have milder symptoms?
So anybody with symptoms would not be told to self-isolate it by the 811 number. They would do an assessment around what criteria they would meet to then go to the testing facility. My understanding is that we've tested so far over 700, I think it's 731 last I checked. So we've tested 731 people so far, 747 so far, and I don't know what percentage of people who call, because they have, if you do try to test out the line, if you do call it, they actually have different options. So they do ask you whether you have cough or fever, and then you press the button, like press 1 if you have this, press 2 if you have that. So there's a triage system built into 811.
Okay, is there a shortage of test swabs in the province?
Not at this time.
Thank you. Kevin Bissett, Canadian Press.
Yeah, good afternoon. Prince Edward Island announced today that it's doing screening at all entry points to the province, and anyone entering PEI, whether it was international travelers or travel elsewhere within Canada, is being asked to self-isolate for 14 days. Is New Brunswick considering the same kind of move?
So I just heard that news this morning, and so all of my colleagues across the country, we were planning to have a discussion around that tomorrow. So that's really concerning news, and we definitely will be having a conversation tomorrow about that, and more to follow.
Did you have another question, Kevin?
I do. We heard this morning from the Prime Minister about efforts to repatriate a lot of Canadians from abroad. Do you have any handle on how many New Brunswickers are involved with that?
Not at this time, but we would be given that information if it's something that's organized through the Global Affairs Canada and Public Health Agency of Canada, then they would be giving us that information.
Thank you. Rose Saint-Pierre de Radio-Canada.
Oui, bonjour. Ma question est pour Dr. Russell. Dr. Russell, j'imagine que vous avez fait des scénarios de prédiction pour cette crise-là. Combien de personnes infectées au Nouveau-Brunswick on pourrait avoir au pire de la crise et ça représente combien d'hospitalisations?
Alors, chaque province, même au niveau national, on fait des modèles pour dire le plus pire scénario, des autres scénarios. Puis c'est vraiment dépendant les mesures qu'on a en place aujourd'hui et comment la situation va évoluer. Comment le progrès va de la situation. Puis ça dépend sur plusieurs choses. Ça dépend sur les mesures qui sont en place, la manière qu'on continue à tester, la manière que les gens écoutent nos avis, les directives. Ça dépend aussi sur la situation autour des autres pays. les États-Unis inclus dans ça. Alors, quand les situations changent, même dans les provinces, alors vous avez bien juste d'entendre que l'annonce avec l'île du Prince-Édouard, alors même avant, c'était des informations qu'on prenait d'autres endroits hors du Canada. Là, c'est des informations qu'on trouve dans notre pays et aussi ici au Nouveau-Brunswick.
Est-ce que vous avez un suivi, Rose?
Oui, et j'aimerais savoir si vous avez fait des prédictions concernant la région où on risque d'avoir le plus de besoins dans les hôpitaux.
Les mesures qu'on a prises à ce moment-ci, c'est vraiment de diminuer les demandes sur le système présentement. Et je crois qu'on a vu comme une diminution de presque 30% des services qui sont offerts pour nous donner les ressources et la capacité de gérer les problèmes avec s'il y avait une augmentation des cas ici au Nouveau-Brunswick. C'est vraiment intéressant maintenant les choses qui arrivent dans les autres provinces, puis les étapes, puis les choses qui sont mises en place ici déjà. Ça nous donne une bonne sens maintenant, présentement, d'évaluer la situation cette semaine, la semaine prochaine, puis on peut garder sur l'information qu'on a sur les résultats de tous les tests pour voir un bon portrait de la situation.
Merci. Gary Moore, CBC.
Hi, my first question is for Dr. Russell. Horizon is looking to retirees and students for help. What's the staffing situation like right now if they're putting out this call for help, and what would that extra help be for right now?
So I know New Brunswick Medical Society was doing some of that work. I haven't spoken to the RHAs recently about that, but my understanding is that anywhere they see a need in terms of where they can help out, obviously those are resources that are really important, and planning at this point in time, again, those discussions are happening and getting prepared for more cases as time goes on.
Okay, my second question would be for the Premier. Premier Higgs, I'm just wondering, with the news about PEI that they just announced there regarding people coming onto the island having to self-isolate, and Newfoundland as well, but in particular to PEI, I'm just wondering how is this going to impact people who travel there from this province on a day-to-day basis for work and business that are still working?
Well, I guess, that was news that they have done that right now, but we have had these discussions with other colleagues across the country, and most recently with Stephen McNeil just yesterday about our cross-border travel. And while we've limited all of our employees to stay within New Brunswick, we decided that we weren't going to limit between our respective provinces. I know it's a single entry point into PEI. It makes it, I guess, easy to track in that sense. We all kind of will do our own thing in relation to the movement, but now we're focused on out of country travel, certainly from the U.S. And as we've said before about snowbirds coming home and the message they're getting at the border and the need to self-isolate and to take this very seriously. That is our focus. We will be discussing this week further measures for cross-Canada travel. And I think we can get synced up with other provinces in that regard. And I likely will have a discussion with the Premier of PEI just to understand the criteria and what he felt was necessary for his province.
Thank you.
Sorry, I missed the beginning. How many presumptive cases and confirmed cases do we have?
That would be on the website, Megan. Andrew Waugh, Brunswick News.
Yeah, so Premier, based on what I'm hearing, the Premier of Prince Edward Island didn't give you any kind of a heads up on this. Is that correct?
I wasn't aware of it, no. But that's okay. I mean, obviously, I wouldn't expect him to seek my permission, and he wouldn't expect me to seek his.
And follow up, Andrew.
Yeah, Dr. Russell. Most of these new cases involve a cruise ship. I understand you got privacy concerns, but can you tell us if they were all on the same cruise ship? Did they all come home together? Are there concerns about the flight that they were on? That kind of thing?
I don't have any other information than what I presented you today. The regional staff are the ones that are doing the contact tracing, and if there were concerns like that, they would be letting us know, and we would be letting you know.
Bobby Jean McKinnon, CBC.
Hi,
hear, so apologies if I'm repeating something. But we've heard how many negative tests there have been, but how many tests are pending? Hello?
Hi, I don't have that information. We are going to be having a number of tests that get done every 24 hours, so we will always have some in the hopper, as they say, so I don't have that number, but I can tell you how many tests have been done and how many presumptive cases we have. We've done 747 tests.
So how many tests have been done is the number of negative tests? That's the only number you have?
No, that's the total number of tests that have been done, so it includes the positives and the negatives.
I'm sorry, I'm having a lot of trouble hearing.
It includes the positives, the negatives, and the pending.
But you don't have the pending figure?
I do not.
Okay. Is that something you can get?
As of right now, the situation is evolving, so I present the information that I have, and what I have today is I have the number of tests that were completed, and I have the number of tests that are presumptive and confirmed from NML.
We've been asking though daily, and we've never gotten any indication. I mean, are we talking dozens, hundreds? Can you give us a rough idea?
I can just tell you that in terms of the capacity for testing, that has been ramped up. So we're upwards of over 100 tests per day. So that, I think you can understand that we're doing over 100 tests per day right now.
Okay. And
Thanks.
I was also wondering, other provinces such as Nova Scotia have completed many more tests than we have. And I'm just wondering, do we have different criteria for testing than other provinces? And if so, how do they differ?
No, we don't necessarily have different criteria. I think there's probably a combination of factors in terms of what has happened so far in the situation. So here in New Brunswick, every time there was an assessment done around a COVID-19 possible case and that kind of investigation, the risk assessment was done, and there were the criteria have actually evolved, but they've evolved nationally across the country. So I can't say exactly why there would be more tests done. I can just tell you what we have been doing and what we will continue to do and responding to this situation.
Okay, that's all the questions from the journalists. Thank you very much, everyone, for attending. Merci tout le monde.